Transplant Waitlist. Placement on the waiting list. After you have been placed on the list, you will receive a phone call and an official letter from your pre-transplant coordinator notifying you of the date you were placed on the waiting list. The letter also includes further instructions about what to do while you are on the waiting list. If anyone tells you that you are listed, but you have not received a letter or a call from your coordinator, please call your coordinator. Do not assume you are listed. Heart transplant status. Once placed on the UNOS national waiting list, you will be assigned a heart transplant status between 1 and 6. Status 1. VA ECMO. Non-dischargeable, surgically implanted, non-endovascular biventricular support device. Mechanical circulatory support device, or MCSD, with life-threatening ventricular arrhythmia. Heart transplant status. Status 2. Non-dischargeable, surgically implanted, non-endovascular left ventricular assist device, or LVAD, intra-aortic balloon pump, or IABP, VTAC, VFib, mechanical support not required, percutaneous endovascular MCSD, mechanical circulatory support device, or MCSD, with device malfunction or mechanical failure. Total artificial heart, or TAH, biventricular assist device, BIVAD, right ventricular assist device, RVAD, or ventricular assist device, VAD, for single ventricle patients. Heart transplant status, Status 3. Dischargeable left ventricular assist device, or LVAD, for discretionary 30 days. Multiple inotropes or single high-dose inotrope with continuous hemodynamic monitoring. Non-dischargeable, surgically implanted, non-endovascular LVAD after 14 days. VA ECMO after 7 days. Percutaneous endovascular circulatory support device or intra-aortic balloon pump, or IABP, after 14 days. Mechanical circulatory support device, or MCSD, with one of the following: device infection, hemolysis, pump thrombosis, right heart failure, mucosal bleeding, or aortic insufficiency. Heart transplant status, 70. Status 4. Dischargeable left ventricular assist device, or LVAD, without discretionary 30 days. Inotropes without hemodynamic monitoring. Retransplant. Diagnosis of one of the following: congenital heart disease, or CHD, ischemic heart disease with intractable angina, hypertrophic or restrictive cardiomyopathy, amyloidosis. Heart transplant status, Status 5. On the wait list for at least one other organ at the same hospital. Status 6. All remaining active candidates. If your condition worsens, updates can be made at any time to increase your score with UNOS. Regular assessments will be made by your heart transplant team. Matching with your donor. Heart transplant candidates are matched with donors based on blood type. The donor heart must come from a donor with the same or compatible blood type as you. UNOS status between 1, 2, 3, 4, 5, or 6. Waiting time, how long you have been on the waiting list. Size of the donor. The donor must be comparable size to you. Location of the donor in relation to the transplant center. Matching with your donor. Once a patient is identified with a brain injury by a physician, the patient will undergo extensive neurological testing. If the result of this testing is irreversible brain death with no chance of recovery, the local organ procurement organization, or OPO, will be called. Our local OPO for the Los Angeles area is One Legacy. Their website is onelegacy.org. Other approved OPOs are in Northern California, San Diego, Arizona, Nevada, New Mexico, and others. Heart donors are usually individuals who have suffered a serious brain injury either from an accident or stroke. Matching with your donor. An OPO professional trained in discussing organ donations will speak to the family about possible organ donation. Procurement coordinators also work for the OPO and are well-trained individuals who work in hospitals with the donor to ensure the patient is in good condition for organ donation. The procurement coordinator also ensures the fair and equitable distribution of acceptable donor organs to transplant candidates. Organ donor information is anonymous and protected health information, or PHI, by law. Thanking your donor family. You will be instructed on how to write a thank you letter to your donor family that will be provided to your donor family by the OPO. The donor family may or may not respond to your letter or letters, but many times they do after some time passes. This donor family is grieving, and the letters they receive from recipients and their families are often very healing and helpful. Waitlist patient responsibilities. While you are waiting for your donor heart, it is important for you to stay as healthy as possible, so when a donor heart becomes available, you are in the best possible condition to undergo the transplant surgery. It is not possible for us to predict how long you will have to wait for a donor heart, as we are waiting for a random event to occur, brain death of a potential donor. Some patients wait days, while others wait weeks, months, or years. Waitlist patient responsibilities. As a transplant candidate, you must notify the transplant team if there are any changes in your medical condition. For example, you start to feel worse or have an infection, including a cold or a flu. You are hospitalized for any reason. We may want to transfer you to UCLA if at another hospital, depending on the reason. You receive a blood transfusion. Your contact information, such as phone numbers, change. You are out of town, on vacation, and far from UCLA. Your insurance changes. This is very important.